to be a doctor, you sort of have to have a certain level of compassion and empathy for people's problems, and you want to be able to fix those problems and find solutions, but also try and be reassuring to patients that everything's going to be okay. So you have to have assurance in your field that you can actually cure the problem. The great thing about orthopedics is that the body does the healing. We mainly need to keep the body straight, aligned, and obviously we need to repair ligaments when they're torn, or fractures. We do hip replacements when the hips are worn out, but the body plays a big role in healing things, and it's quite different than a situation where people have cancer, for example, or need to have certain body parts resected, whether it's in your abdomen or your lung, or open heart surgery is another good example of something you can do to replace a valve and that kind of thing. But orthopedics was a real hands-on thing, and as I mentioned, I got very interested in that when we had to put the dog back together when I was 13 or 14 years of age. So it fascinated me with the plates and screws. I've always been sort of a fix-it kind of guy, and I just carried that over into my profession, and that's essentially what I do on a daily basis.